over the past 24 hours, we have identified 3 additional confirmed cases of COVID-19. So at present, we now have a total of 64 confirmed cases of COVID-19 being reported by the Federation of St Kitts and Nevis. As you can see, 50 St Kitts, 14 Nevis. 45 of these cases have recovered fully, and at present, we are monitoring 9 active cases. Please note that the 3 additional cases are linked to previous cases. Health practitioners across the globe have been monitoring this COVID-19 pandemic. We've been responding to this COVID-19 pandemic, and to date, 167.5 million persons have been confirmed with this disease, and 3.5 million deaths have been reported. Concurrently, territories across the globe, they have started their COVID-19 vaccine rollouts, and to date, 1.5 billion vaccine doses have been administered. In the United States of America, 33.2 million cases have been confirmed and over 590,000 deaths. The COVID-19 pandemic continues to impact the Caribbean region with over 176,000 cases reported amongst the CARIFORA member states and over 3,000 deaths reported. The pandemic is also impacting the organization of Eastern Caribbean states, and so when you look at the 9 OECS territories inclusive of Barbados, collectively over 12,700 cases have been reported, along with 180 deaths. Again, the COVID-19 vaccine is being rolled out in each of these OECS territories. In St Kitts and Nevis, it's about 13 weeks now since we've been administering our AstraZeneca Oxford vaccine, and as at end of work day yesterday, over 23,340 vaccine doses have been administered. 17,579 in St Kitts, 5,761 in Nevis. What does this really mean? So, ladies and gentlemen, as at yesterday, 51.6 or 52% of the target population has been covered with the first dose of this vaccine, and by extension, 19% of the target population is fully vaccinated. As I said before, in the Federation, we are now monitoring 19 active cases. This is the highest number of cases we've had at any one time since we started our response within the first quarter of 2020. We are working assiduously to contain this expanding cluster of COVID-19 cases. Please note the terminology, cluster of cases. At present, this describes the current transmission pattern in our federation. The Ministry of Health, we've been working throughout the day, 24/7, in terms of our contact tracing. This extensive exercise started last week, Wednesday, when we identified the first case in this most recent cluster. The aim is to identify, quarantine, and test all the possible contacts of this recent case, the recent cases. Now, I want to just pause here. Now, in terms of the contact tracing, we've been, we've touched and tested yesterday, up until yesterday, over 700 persons, and today alone, we will be testing over 200 persons. Now, the Ministry of Health team went to the Washington Archibald High School. We went to the Bastia High School and the Seventh-day Adventist Primary School earlier today. As I speak, the Ministry of Health, or the Public Health team, is presently at the Tyrrell Williams Primary School. And so the recommendation for all the students who are being tested today is as follows. One, we are asking the students who were tested today to remain in self-quarantine. So only the students impacted today will be asked to self-quarantine. However, households, meaning the parents, guardians, and everyone in the household of these students, we are asking you to adhere to the COVID-19 prevention and control measures at all times. So this means the students in these schools, your household, you need to wear your face mask at all times during the waking moments of the day, and when you're interacting with each other, make sure you keep on your face mask, and hand sanitization is of critical importance at this time. And the purpose of this is, since the impacted child, was the first year contact of the cases within the school system, we want you in the home setting to sanitize your hands before and after each physical encounter, and make sure you keep on your face mask throughout the day. So these are the recommendations for the schools that were impacted today. In essence, the virus is back. In other words, it has been reintroduced into the Federation. And so it's important for each of us to do what is necessary to protect ourselves from this virus. Now, the following 6 measures are ways in which you and I can protect ourselves from this virus and prevent the spread of this disease. 1, we are urging you to come forward and get vaccinated. Now, the vaccine is that one tool that we have in our possession to help to contain and combat this infection, or even this wave of infections. So we want you to empower yourselves with the facts about the benefits of this vaccine. Please note that it's safe, it's effective in preventing moderate to severe disease. It's very effective in reducing your risk of transmitting this disease. So we want you to come on board and accept this vaccine. We urge you to adhere to the prevention and control measures. So ladies and gentlemen, once you step out of your home and you're in the public domain, we want you to keep your face mask on. And last night we got a number of questions regarding the proper way in which to utilize the face mask, and so it's well exhibited here. You must cover the nose and mouth. The face mask must adequately cover the nose and mouth. We want you to maintain good hand hygiene. So after you touch, after touching the high touch areas, doorknobs, countertops, you must sanitize your hands. Keep your hands out of your face, your nose, your eyes. And you need to maintain adequate physical distance from others when in public places. So if you're going to be taking public transport, you're going to go on the bus, you're going to go on the ferry, you must wear your face mask. The face mask must cover your nose and your mouth for the duration of your journey. Upon entering the bus, you sanitize your hands. When you jump off the bus or you come out of the ferry, you need to sanitize your hands. While or during your journey, keep your hands away from your face. This is very important because the person sitting next to you may just be carrying the virus. I need to mention funerals. Tomorrow I'm going to a funeral, and I want to recommend that you need to wear your face mask during the entire funeral service, while in the church and even at the cemetery. You must wear your face mask, keep it covering your nose and mouth for the entire duration of the service, while in the church and while at the cemetery. And make sure you maintain that 6 feet distance between yourself and the other attendees. If you are providing care to a loved one or a child, in this case, a child who may be attending the Washington Archibald High School, the Bastia High School, the Seventh-day Adventist Primary School, the Tyrrell Williams Primary School, the parents, I'm asking you to wear a face mask and even disposable gloves at all times while interacting with that child who may have been exposed to the virus. I want you to avoid crowds at this time. If you are experiencing any of the COVID-like symptoms, you need to remain at home. You must stay at home. However, you need to seek health care. So make a call to your regular primary care doctor or call the 311 hotline and seek advice regarding getting tested and getting medical care. And if you are experiencing any of the COVID symptoms, we are asking you to avoid taking public transport. You can, ask a relative or, a loved one to take you to the doctor or to the emergency room if that is what is required. If you are diagnosed with COVID-19, we want you to remain in isolation. And the reason for this is that we want to prevent the spread of the virus from yourself. If you are diagnosed, we want to prevent the spread of the virus to others who you would normally interact with. If you have been identified as a contact of a case, and if you are placed in quarantine, we are asking you to remain in place. Remain in the confines of your home if you are asked to self-quarantine, or if you are placed in a government or a COVID-19 certified facility, we are asking you to remain in the confines of that entity. Now, this surge in COVID-19 cases is a serious threat to our health system, and it's very important for us to adhere to the recommendations I just listed. Each of us, we have a part to play in terms of flattening the curve. Our aim is to keep the total number of confirmed cases at the lowest possible level. And in order for us to achieve this, we must continue this all-of-society approach. We need all hands on deck at this critical time. We are engaged in a warfare. It's a battle. We are fighting for our lives, and we want to use this opportunity to remind listeners about the AstraZeneca Oxford vaccine. It's the main tool that we have at this time in terms of fighting this virus, and we want you to come forward and get vaccinated. So the takeaway message this afternoon is to, if you have not already done so, come forward, get vaccinated, and also you need to keep your face mask on at all times once you've left your house. And you have to sanitize your hands throughout the day and maintain adequate distance between yourself and others throughout the day. So those are the takeaway messages from this afternoon's presentation. Thank you.